Like all living beings, cats are not immune to the passage of time or the onset of illness. But unlike humans, they are experts at masking discomfort, making it challenging for even the most attentive owners to detect when something is wrong. This is why it's so important to understand the signs of declining health in your feline friend. Recognizing these subtle cues can mean the difference between a manageable condition and something far more serious. In this video, we'll share 10 critical warning signs that may indicate your cat is seriously ill or approaching the end of their life. While some of these signs might be mild at first, they could signal underlying issues that require immediate attention. Stay tuned to learn how to identify these symptoms and take action to ensure your beloved pet receives the care they need. Number 1. Their personality has changed. Like us, cats develop distinct and complex personalities over the course of their lives, and it's natural to see some changes as they age. For instance, a once playful kitten may become a more reserved adult, and senior cats often mellow out or grow more sedentary. However, when a cat experiences a sudden and dramatic change in temperament, it can be a cause for concern. Signs such as increased irritability, sudden withdrawal, or unexpected aggression are not merely quirks of aging but can signal deeper issues. These abrupt behavioral changes may stem from physical discomfort, underlying illness, or significant emotional stress. Painful conditions like arthritis, dental issues, or internal injuries can cause a gentle cat to become defensive or even aggressive. Emotional stressors, such as changes in their environment or loss of a companion, can also trigger depression or anxiety in cats. If you notice such a sudden shift in your cat's usual demeanor, consult a veterinarian to rule out or address any potential health problems. Number 2. They're neglecting grooming and hygiene. Cats are famously fastidious creatures, spending a significant portion of their day grooming themselves to maintain a sleek and healthy coat. Grooming isn't just about cleanliness for cats. It's also a way for them to regulate body temperature, stimulate blood flow, and even calm themselves in times of stress. When a cat suddenly stops grooming, it can be one of the earliest signs of an underlying health problem. Matted fur, an oily coat, or an overall disheveled appearance should not be overlooked. In addition to grooming, cats maintain hygiene by marking their territory through clawing, rubbing against objects, and faithfully using their litter box. A cat that neglects these habits, especially after years of consistency, may be signaling pain, mobility issues, or emotional distress. Such changes could point to serious conditions like arthritis, dental disease, or even depression. If you observe these shifts in behavior, a prompt visit to the veterinarian can help uncover the root cause and provide your cat with the care they need. Number 3. Fluctuations in body temperature. A healthy cat's body temperature typically falls within the range of 100.4 to 102.5 degrees Fahrenheit. Maintaining this temperature is crucial for their overall well-being, as it reflects the proper functioning of their immune system and internal organs. A drop below this range may indicate that your cat is battling a serious illness, experiencing hypothermia, or suffering from a weakened immune response. Conversely, a temperature above this range could signal fever, infection, or inflammation requiring immediate veterinary care. You can get an initial sense of your cat's body temperature by feeling their nose and paw pads. While these areas are not as precise as a thermometer, they can provide useful clues. A nose that feels unusually cool or paw pads that are cold to the touch could suggest a lower than normal temperature, especially if paired with lethargy or other concerning symptoms. For accurate readings, use a pet-safe rectal thermometer and consult a vet promptly if the temperature is outside the healthy range. Number 4. They've lost their appetite. A sudden loss of appetite in cats can be an alarming signal of underlying health issues. While it's normal for older cats to eat less than their more energetic kitten counterparts, a complete disinterest in food or water is a red flag. Like any other animal, cats rely on consistent nourishment to maintain their energy levels and support essential bodily functions. When they stop eating, their bodies begin to break down fat and muscle for energy, which can quickly lead to noticeable weight loss and physical weakness. Severe weight loss is often accompanied by visible signs such as protruding ribs, a sharp or bony spine, and a pronounced pelvis. These indicators typically suggest serious nutritional deficiencies caused by illnesses like kidney disease, gastrointestinal issues, or infections. Other warning signs, such as vomiting, diarrhea, or blood in their urine, can compound the problem and signify life-threatening conditions. If your cat shows any of these symptoms, immediate veterinary care is essential to identify and treat the cause before it progresses further. Number 5. They seek solitude. As cats approach the end of their lives, it's common for them to seek solitude. This behavior stems from their instinctive need to protect themselves when they feel vulnerable or unwell. In the wild, a weakened or dying animal isolates itself to avoid predators, and while domestic cats are safer in their homes, this survival instinct often persists. You may find your cat retreating to quiet, secluded spots, such as under furniture, in closets, or in corners of the house they don't typically frequent. However, not all cats will isolate themselves in their final days. Some may continue to seek comfort from their human companions or maintain familiar routines. Solitude can depend on a cat's individual personality, their bond with you, and the nature of their illness. But if your usually social cat begins avoiding interaction, it's worth paying close attention to other potential symptoms and consulting a vet to assess their health and comfort. Number 6. Excessive sleeping. Cats are naturally inclined to sleep for much of the day, with adult cats typically resting for 15 to 16 hours, which is around 75% of their daily routine. This behavior is part of their evolutionary need to conserve energy for hunting and other activities. However, a noticeable increase in sleep duration beyond this norm can indicate that something is wrong. If your cat seems to spend nearly all day sleeping or shows little interest in their usual routines, it may be a sign of an underlying health issue or advancing age. Lethargy and excessive sleeping often go hand in hand with serious medical conditions, such as infections, chronic illnesses, or pain. If your cat also avoids play, no longer seeks interaction, or appears uninterested in activities they previously enjoyed, these are additional red flags. Number 7. Foul breath. While your cat's diet may not smell very appealing to you, their breath should not emit a strong or offensive odor. Persistent foul-smelling breath can be an early warning sign of health issues that extend beyond the mouth. Common causes include dental problems such as tartar buildup, gum disease, or tooth decay. These conditions, if left untreated, can lead to pain, difficulty eating, and even infections that spread to other parts of the body. Bad breath can also indicate more serious underlying issues affecting internal organs. For example, a sweet or fruity odor might suggest diabetes, while a foul, metallic smell could point to kidney disease. Although it might seem like a minor symptom, bad breath should never be ignored. Regular dental checkups and veterinary care are essential to identify the root cause and prevent further complications. Number 8. They have lumps. The discovery of lumps or unusual growths on your cat's body should never be taken lightly. These could be signs of various health conditions, including cancer, which is unfortunately a common issue in cats. Like humans, cats can develop tumors, both benign and malignant, in different parts of their bodies. These lumps can appear anywhere, under the skin, in the mammary glands, or even in internal organs. While not all lumps are cancerous, early detection is crucial for a better prognosis. Regularly checking your cat's body, especially in areas like the neck, underarms, and abdomen, helps you identify any abnormal growths. If you find a lump, it's essential to consult with a veterinarian as soon as possible. The vet will be able to perform tests to determine whether the lump is cancerous or related to another condition, allowing for prompt and appropriate treatment. Number 9. They've grown more aggressive. A sudden shift from a calm, affectionate cat to one displaying aggressive behavior can be a concerning sign, often linked to severe pain or confusion. Cats that are in physical discomfort may lash out unexpectedly as a defense mechanism, particularly if they are disoriented or frightened by the sensations in their body. This aggressive behavior can be triggered by conditions such as arthritis, injury, or illness, all of which may cause a cat to feel vulnerable and react with hostility. Additionally, cats experiencing cognitive decline or sensory issues might struggle to recognize familiar faces or surroundings, heightening their anxiety and contributing to aggression. If your cat suddenly becomes aggressive or fearful, approach them calmly and with caution. Handling them gently, avoiding sudden movements, and seeking immediate veterinary advice can help diagnose the underlying cause of the aggression and ensure your cat receives the appropriate treatment to manage their discomfort. Number 10. Other abnormal signs. In addition to the more obvious symptoms, there are several other subtle signs that may indicate your cat is facing a serious health issue. Abnormal vital signs, such as irregular heartbeats, significant changes in blood pressure, or difficulty breathing, are critical to monitor. These physiological changes often point to underlying health conditions that require prompt attention. Pale or discolored mucous membranes, which you can check by gently pulling down your cat's lower eyelid or examining their gums, are another concerning sign that should not be ignored. Recognizing the warning signs of illness early can make all the difference, allowing you to provide timely medical care and comfort during their most vulnerable moments. While no one wants to think about the end of their pet's life, understanding these signs and knowing when to seek help is an essential part of responsible pet ownership. Thank you for watching. If you found this video helpful, don't forget to give it a thumbs up and subscribe for more content on pet health and well-being. Share your thoughts or experiences in the comments below. We'd love to hear from you. Stay tuned for more videos and take care of your furry friends.